Hi everybody. Today let's discuss with Dr. Anil Kamath, Senior Surgical Oncologist at Apollo Hospital as well as at Therrapie. Good morning, Doctor. Doctor, what is stomach cancer? Is tumorous or non-tumorous cancer?
It can be both. Certain tumors in the stomach can be cancers and certain can be benign tumors. But benign tumors in the stomach are lesser. The chances that a big ulcer or tumor in the stomach is cancerous is much higher.
Can we remove tumors by surgery for stomach cancer?
Yes, by and large, surgery forms the most important modality of treatment, and especially if the tumor has not spread anywhere, it is confined to the stomach, then cancer is one of the most important treatments for stomach cancer.
Doctor, is stomach cancer is due to unhealthy food habits or starvation or irregular food habits?
It can be a multiple, there can be multiple factors here. We can't attribute it only to food, though certain types of food are known to be associated with stomach cancer. The more important factors here are smoking. Smoking has got a definite relation with stomach cancer. It can be due to repeated acid reflux. What we can see in certain this thing. This is known to produce upper stomach cancers. They are more often associated with reflux symptoms. And thirdly, there is an infection with a bacteria known as Helicobacter pylori, which is known to have a higher incidence of with the stomach cancer.
Doctor, is stomach cancer is common in India?
It is among the more common cancers, especially if we take this Karnataka region and South India. So that's where we think that diet may have a role in stomach cancer, but there is a lot of geographical variation. But definitely it is among the more common cancers.
Doctor, this is very interesting question. The foods are based on the locality where the people live. Like in Karnataka, we eat lot of ragi mudde, rice kind of thing. Is the stomach cancer comes by eating some pizza, burger or North Indian food? Is there any chances like that?
It is not as straightforward as that. Till now, we don't have a definite relation as to eating this particular type of food causes stomach cancer. So, it is not as straightforward that just eating something will produce stomach cancer.
Doctor, what are the causes for stomach cancer?
Smoking is a very important factor. Most of the stomach cancer patients we see have got a history of smoking, though it can happen even without this thing. The other factor which I mentioned is gastroesophageal reflux. Those who have these reflux symptoms are quite common. People get this regurgitation after taking food. It is not immediately cancerous, but when it is untreated and when it is there for a long period of time, this can lead on to cancer. Infection by a bacteria, Helicobacter pylori, is known to have an increased chance of stomach cancer.
Doctor, is stomach cancer can spread to other organs?
Yes, like any other cancer, stomach cancer can also spread to other organs. Usually it spreads to the nearby lymph nodes and quite often it spreads to the liver also.
Doctor, how can we detect the stomach cancer early?
It can be detected early if one has a low threshold to do a endoscopy. So if one has got upper GI symptoms like dyspepsia, belching, vomiting, then they can go to a gastroenterologist and get an endoscopy done. Then the cancer can be detected early. Otherwise, if people tend to ignore these symptoms, they can present in a much later stage.